Hello. The following presentation, titled A Call for Integration of Complementary and Alternative Medicine in America's Healthcare System, is a project by University of Southern California master students Victoria Gershuni, Sarah Lambeth, Daniel Niku, and Kristin Webb. The following will be the topics of their discussion. First, what is Complementary Alternative Medicine, or CAM? Second, what are the current U.S. healthcare system processes? Third, what are the current and future endeavors of CAM? Fourth, what are the bioethics associated with incorporation of CAM? And finally, a discussion of provisional suggestions or methods for incorporating CAM into the U.S. healthcare system. So what is CAM? CAM stands for Complementary and Alternative Medicine. CAM is composed of many disparate practices that are all united by a common view of health and healing. This philosophy can be thought of as a new ecology of health, sustainable medicine, or medicine for a small planet. CAM, as a philosophy, is based on 7 tenets. These include the role of science, wellness, self-healing, bioenergy, nutrition, and natural products, plants, and most importantly, the concept of individuality. CAM goes beyond preventing disease. It focuses on engaging the self-healing properties of each individual in order to manipulate bioenergy and establish wellness. In the United States, CAM is used in conjunction with conventional medicine and not in place of. It is interesting to note that in the United States, approximately 38% of adults and 12% of children are using some form of CAM, and most of the therapies that are being used are natural products, commonly used for back and neck pain. With the basics of CAM in mind, we need to ask ourselves what integration means for the United States healthcare system. Currently, there is a debate over the immeasurable costs and benefits of integration of CAM into conventional medicine versus the continued existence of multiple medical practitioners and pluralism among healing choices for consumers. In the context of U.S. healthcare, integration is interpreted to mean improved standards of evidence, quality, appropriateness, and availability of care within the mainstream healthcare system. CAM systems imply the importance of individuality and choice. And since we live in an era when the active engagement of the individual in his own health is a paramount goal, individuality and choice could not be more salient. Now we will provide a short discussion of the United States healthcare system. Although nearly 46 million Americans are uninsured, the United States spends more on healthcare than any other industrialized nation. The World Health Organization has ranked the U.S. as number 1 in spending, yet 37th in overall healthcare coverage. The United States has a multi-payer system, meaning the government as well as private insurance carriers provide funding. Some examples of private insurance carriers are HMOs and PPOs, which offer subscribers more choices in their health coverage than government-sponsored insurance. On the other hand, government-sponsored insurance is funded directly by payroll taxes. Medicaid, for example, for the poor, Medicare for the elderly, and Veterans Administration for those who have served in the military. From the National Coalition on Health, total healthcare spending was $2.4 trillion in 2008, or $7,900 per person. In the last year, total healthcare spending represented 17% of the U.S. gross domestic product. In the pie graph shown on the left, the distribution of this spending is shown. The category of Other includes medical technology spending, which according to the Congressional Budget Office has been responsible for almost half of the growth of all healthcare spending over the last few decades. Surveys show that the primary reason people are uninsured is the high cost of health insurance coverage. A survey by The Access Point shows that more than 25% of those surveyed reported that they experienced housing problems as a result of medical debt, including the inability to make rent or mortgage payments and the development of bad credit ratings. CAM offers cost savings to the current system through cheaper alternatives to pain management while providing more natural forms of healing. In order to incorporate CAM into the current healthcare system, evidence of cost savings needs to be assessed. One study reviewed articles regarding the cost-effectiveness of natural health products such as vitamins, herbal remedies, and homeopathic medicines. Research reviewed 9 articles specifically, including post-operative complications, cardiovascular disease, gastrointestinal disorders, critically ill patients, and urinary tract infections. These studies found that the natural health products provided a reduction in overall cost for each of these conditions assessed. Considering the lack of use of these products in conventional healthcare, cost effectiveness is of great importance for policymakers. We are now going to shift gears and take a look at the need for CAM research as well as where the current research is leading. Over the last 10 to 15 years, there has been a shortage of government funds available for scientific research, and because of this, the priority for funding has gone to conventional therapies and pharmaceuticals. Unfortunately, diverting funds away from CAM research poses a threat to the millions of Americans using these therapies. CAM research needs to be funded in order to find the best treatment options for patients, and will also build a knowledge about CAM therapies in order to avoid potential drug interactions. In 1998, the National Institute of Health incorporated the National Center for Complementary and Alternative Medicine, and in 2008, they received $121 million in government funds. The center funds CAM research and training, and also acts as a clearinghouse for information on CAM therapies. But the process of creating reproducible and significant clinical trials is more difficult for many CAM therapies, and thus the center also funds research which aims at creating new clinical research methods for CAM. Here is an example of the hundreds of clinical trials that the National Center for Complementary and Alternative Medicine has completed. It was a study on acupuncture and its effectiveness with treating osteoarthritis pain. Patients were split into 3 groups: 1. Acupuncture, 2. Sham acupuncture, or 3. Physical therapy. All patients continued to take their prescribed doses of NSAIDs and other pain relievers. The study found a 40% decrease in pain and a 40% increase in function in the patients receiving acupuncture over those in physical therapy. Now, the amount of CAM research being done is expanding, but the research needs are still unmet, especially when it comes to randomized clinical trials. Under President Obama's recovery plan, there are increased funds available for scientific research, and some of these funds need to be directed towards CAM research. Final portion, we will overview the bioethics involved with CAM. Also, we will offer suggestions for the Obama administration to integrate CAM into their healthcare initiatives. The growing availability of CAM to the U.S. public is a glaring contrast to the perceived dominant allopathic practices in the United States. What have been considered dominant medicinal practices are in fact incorporating or being replaced by alternative medicines. Yet, as it has been previously mentioned, the bioethics of all these practices have not been yet resolved. It is important to note that many of the herbal supplements and vitamins provided on the market are in fact not reviewed by the FDA for various reasons, including the lack of federal funds. Thus, the safety and efficacy of these supplements are not reviewed, and there's a potential for harm to the patients. As the number of CAM users increases annually, it is critical that the U.S. government funds the FDA with the money and resources to include as many supplements and herbal remedies as possible to their general overview of safety and efficacy. Now, bioethics follows 3 mandates: autonomy, beneficence, and justice. Autonomy determines that patients should practice self-determination, and they should evaluate what is important to themselves. Beneficence insists on minimizing the risk and harm inflicted on a patient and ultimately enhance their well-being. Justice discusses that all individuals should be given the fair treatment that they are due. Each of these conditions should be applied to current and future CAM endeavors, particularly with the increasing availability of herbal and vitamin supplements. As the Obama administration devises a new healthcare policy for the American people, it is suggested that the administration reviews the practices and products that are available through complementary alternative medicine and the bioethical impacts it may have on healthcare. Moreover, it is critical that the federal government re-examines the provisions given to the FDA and gradually initiates an efficient distribution and monitoring of alternative medicines that are available to the general U.S. public. Thus, we suggest the following. First, better FDA oversight and comprehensible guidelines for distribution of these alternative products. Second, mandate policies that efficiently monitor the causes and effects of alternative medicine, both commercially and medicinally. And finally, distribute appropriate funding for CAM so that the ethical and practical applications of these practices are understood. We would like to thank you for your time and consideration, and we hope you have enjoyed our presentation on a call for integration of complementary and alternative medicine in America's healthcare system. Thank you.